Welcome, and thank you for watching this video today. On the first World Compassionate Communities Day, Pallium and other partners want to take this opportunity to share the many examples of compassionate communities initiatives in Canada. You will see examples of how organizations are supporting the work and examples of the work compassionate community initiatives are achieving. Let's get started. We'd like to start by summarizing some of the compassionate communities initiatives featured here. The next Compassionate Communities initiative to be featured is Pallium Canada, mobilizing compassionate communities at the national level. Pallium Canada is a national, non-profit organization that believes improving palliative care in Canada is everyone's business, not just the responsibility of a small number of palliative care specialist physicians and nurses. Every community has the potential to transform our society into a skilled, informed, and compassionate one with respect to palliative care. Whether you are a healthcare organization, healthcare professional, community leader, or influencer, you can help make this happen. Pallium provides practical and evidence-based solutions to increase the quality and accessibility of palliative care in Canada by transforming healthcare practice and engaging communities. Pallium's target audience includes healthcare organizations, healthcare professionals, and community champions. All of Pallium's resources and tools have been built in partnership and with the direct involvement of communities and stakeholders. This engagement has allowed the resources to be adapted for local context. Pallium is continually looking for opportunities to integrate the community approach throughout our initiatives, actively looking to create more linkages. Pallium is committed to being a voice and a champion for this movement in the years ahead. One approach Pallium uses to support the compassionate communities movement is through the creation of resources designed to be used at the local level by those leading the work. Currently, Pallium has developed two resources: the Compassionate Communities Startup Toolkit, which will support a community champion who wants to explore launching an initiative in their community or city, and the Compassionate Communities Sustainability Guide, which builds off the Startup Toolkit and will support the initiative's stages of development. Another approach Pallium uses is to create resources for a specific audience or setting, which will support Pallium's vision and the compassionate communities movement. For instance, the Compassionate Workplace Campaign is a resource focused on increasing the care culture within a workplace by proactively supporting employees who are caregiving, grieving, or living with a serious illness. The Care Connections program is a new resource consisting of a suite of resources and activities to support the millions of Canadians who are caring for their family, friends, and members of their communities. The program resources are provided for free and are designed to empower every Canadian to better support the caregivers in their lives and to help strengthen the important social connections within our communities. Pallium also recognizes the importance of connection within the compassionate communities movement in Canada. To support connection, Pallium created the Compassionate Communities Exchange, which is a digital space where those passionate about the work can learn from the inspiring work of other community champions across Canada and discover new resources to help you launch community-wide change. Pallium has seen a strong uptake in our over 170 resources and supports for the community. Our resources have been accessed 4,886 times since 2017, and the Compassionate Communities sections of our website has been accessed 9,054 times since 2019. Pallium has engaged communities since the beginning. The release of the Compassionate City Charter provided a tool that focused the engagement with the community. Since 2014, there have been 29 engagement meetings hosted and 32 conference presentations completed as a part of our commitment to championing the movement. If you want to learn more about Pallium, explore the resources mentioned here and stay connected via our newsletter or visit our website. The next Compassionate Communities initiative to be featured is Compassionate Communities Movement in British Columbia. The Compassionate Communities in British Columbia is a provincial movement that was sparked by the BC Centre for Palliative Care in 2016. The BC's movement is focused on supporting individuals and families affected by a serious or terminal illness, caregiving, death, and grief to have the best possible quality of life. Our goal is to inspire and support communities to provide emotional, social, practical, and spiritual supports closer to home. As a catalyst for the movement, the BC Centre for Palliative Care adopts effective community engagement and development strategies to support the spread of ComCom across the province. Examples of these strategies include 1. Public awareness to promote the ComCom concept and gain province-wide recognition and support. 2. Offer seed grants to inspire and support new ComCom initiatives. 3. Develop the community capacity by offering tools, resources, training, and coaching. 4. Support networking of ComCom champions to facilitate exchange of ideas, learning, and experiences. 5. Support evaluation of ComCom initiatives to generate evidence for their impact. And 6. Celebrate, recognize, and spread successful ComCom initiatives. We are proud that our movement is continuously growing and expanding. To date, we have supported more than 100 local compassionate community initiatives across British Columbia. Half of these initiatives are based in rural, remote, and Indigenous communities where the support is most needed. The BC's Compassionate Communities initiatives offer a wide variety of volunteer-led support programs including conversation games and information sessions about advanced care planning, workshops to help people cope with grief, social connectedness activities, care navigation to help persons in need get connected to resources in their community that they may not know about or have difficulty accessing, spiritual supports, practical supports, and educational workshops and respite for family caregivers. This is how to reach us. The next Compassionate Communities initiative to be featured is Hospice Palliative Care Ontario. Our initiative is currently supporting conversations about advanced care planning. The purpose is to get community members to have conversations with their family about their advanced care plans and/or help them create their plan with free resources. We also support 2 peer support groups, one focused on caregivers and the other on grief. These sessions create a safe place for people to connect about their experience, share knowledge and resources, and foster connection. All of these programs are hosted at the local community center followed by lunch. We are proud that our initiative and programs are supported by volunteers. The amount of time our volunteers dedicate is inspiring. Here is how to contact us. The next Compassionate Communities initiative to be featured is Building Compassion in Children, Schools, and Communities in Peel. Alan Wolfelt refers to children as the forgotten mourners, often overlooked. We want to change that. We wanted to help build compassionate environments in schools and communities that created open, safe, and supportive places for children and youth to grieve. We started with a small network of like-minded grief and bereavement providers and expanded the circle to include any individuals and organizations that could help us move the needle on our vision and mission. The Compassionate Peel initiative is located in an urban center in the region of Peel. Our initiative is currently focused on supporting our children and youth, families, and informal communities, dealing with grief with a secondary goal to advance conversations about illness, caregiving, grief, and dying. We know that most individuals and families will not require or have access to formal grief support, so we are focused on building the capacity of the informal support systems to create supportive networks locally. The common characteristics that all these people and organizations have is an interest or passion in supporting wellness in children and youth. The individuals and groups engaged include so many different groups: individuals, not-for-profits, community organizations and groups, education facilities, healthcare teams and institutions, business and private practice. On the slide are some of the logos of the partners involved. I have used the Ontario University Admissions logo to symbolize post-secondary schools. As our students have been from so many different institutions, it would be too many to include. Also included are the collaboratives that we participate in or have developed through our commitment to build compassionate communities. As well as this, there are the organizations that have supported our work through funding. We started small, but intentionally, and have continued to engage and build partnerships which constantly remind us the value collaboration has for family and community experience. We continue to build regional networks and are working to extend our communities to broader networks of support. The regional group has expanded to include other organizations across the country representing 10 provinces and territories. The programs have included education with school staff and personnel. Education has been conducted by volunteers and trained staff. We have been requested to continue to expand to other providers like victim services, CAS staff, and now to foster parents. This framework has been shared and replicated by other hospices, organizations, and communities. Awareness is critical. When we share work, resources, and success, we build compassion within our communities and our world. Click on one of the links to learn more. The next Compassionate Communities initiative to be featured is Hospice Northwest. Our initiative is located in the largest city of northwestern Ontario, called Thunder Bay. The initiative is in its early stages, so our main goals are to introduce the Compassionate Communities movement to Thunder Bay, identify key stakeholders who will help move us forward, and begin implementing programs to promote conversations about death and dying in the community. Hospice Northwest hired a Compassionate Communities coordinator through funding to provide a dedicated representative who will ensure the movement can take root in Thunder Bay. Our coordinator started in September 2021, and she will work over the next year to carry out projects that support the initiative. Hospice Northwest has been supported by Lakehead University's Center for Education and Research on Aging and Health and St. Joseph's Care Group Northwest Regional Palliative Care Program in the planning process. Hospice Northwest is a local Thunder Bay nonprofit institution that provides volunteer-based in-home palliative, grief, and caregiver support. The work of Hospice Northwest includes recruiting community members to support people who have been touched by death and dying. This aligns with the Compassionate Community movement, as it promotes community involvement during end-of-life processes. Hospice Northwest also runs projects that align with compassionate communities, including a Photo Voice project, encouraging community members to take photos that represent grief from their perspective. Each year, Hospice Northwest also participates in Hike for Hospice to ensure individuals and family members are provided with support free of charge in the event of a life-threatening illness. These are just two examples of the work we do that aligns with compassionate communities. Since hiring our Compassionate Communities coordinator, Hospice Northwest has been able to move forward with additional projects to support the Compassionate Communities initiative in Thunder Bay. We organized Compassionate Community Planning Committee meetings where we coordinated with the Center for Education and Research on Aging and Health and Northwest Regional Palliative Care Program to plan a town hall meeting this spring. In the meantime, the committee is putting together 3 30-minute lunchtime learn information sessions to spread awareness about compassionate communities and promote the upcoming town hall this spring. Another exciting project that is set to begin in January 2022 is our classroom workshop called Talking About Death Doesn't Suck, where we will enter grade 11 and 12 classrooms and engage in a fun and lighthearted discussion about the topic of death and dying. We hope to make these workshops an annual event within high schools around the city. Finally, we are in the early stages of researching and planning workplace toolkits to educate employers and employees about death, dying, and grief in the workplace, to feel comfortable navigating these conversations in professional settings. We hope to either create our own workplace toolkit or promote a toolkit within the community by presenting it to workplaces in Thunder Bay. We are most proud about hiring our Compassionate Community Coordinator who can dedicate time and ensure our current projects are successful and to plan new projects to ensure our initiative can have long-term success. We are also proud that our initial startup has taken momentum as the pandemic has slowed down initial responsibilities and commitments, have prioritized compassionate community planning meetings. Finally, we are proud of our dedicated working group who, despite many other important responsibilities and commitments, has prioritized compassionate community planning meetings. We are thrilled to see where our initiative will be in years to come. We are so thrilled to be part of promoting the Compassionate Communities movement in Thunder Bay. Hospice Northwest has an amazing group of volunteers and staff who are so inspiring and committed to the important work they are doing. The next Compassionate Communities initiative to be featured is Community Connection and Outreach, supporting education and service delivery in Toronto. Our SVSP for G5 program. The Philip Aziz Centre, a community-based hospice palliative care organization, provides screened and trained volunteers to the palliative care unit at Michael Garron Hospital to provide hospice care to patients and families. We engage the community by providing whole-person, client-centered hospice care to patients at a hospital PCU and related health networks in Toronto, delivering staff and volunteer education, wellness and professional development, and providing grief and bereavement support. We are most proud of sharing our wonderful volunteers who have completed 30-plus hours of specialized hospice palliative care training to join the hospital care team. As professional healthcare providers, ensuring the psychosocial needs of patients are met. We have been doing this partnership since 2015. We are located in Toronto, Canada. Our goal is to increase access to hospice services in various locations. Our audience is adults requiring palliative care who are dying in hospital and the family and friends who are experiencing the death of a loved one. Our Education Student Placement Partnership. The Philip Aziz Centre and MAiDHouse, a hospice palliative care organization, partners with York University, Ryerson University, Windsor University, St. Clair College, and University of Toronto to provide social work, gerontology, and child and youth worker student placement opportunities to enhance student knowledge of palliative care to meet the needs of vulnerable people they may support in healthcare and social sciences. We engage the community by educating and training full healthcare and social services providers on the unique needs of palliative patients, clients, and provide schools with access to education and professional development to enhance student experience at school and meeting the students' learning objectives while providing them with practical frontline care experience. We are most proud of providing students of all ages the opportunity to work with a multidisciplinary team to deliver critical supports to vulnerable populations, receiving student feedback, which is always filled with gratitude for the impactful experience of working with our population and within our programs, and the program being ongoing since 2017. The program location is in Toronto and Windsor. Our goal is to educate and encourage future changemakers on what hospice palliative care is and looks like. Our audience is students achieving their BA or MSW in related fields and educators, placement coordinators, and other students at the school. Our THN's multi-agency training program. Philip Aziz Centre, a community-based hospice palliative care organization who first opened in 1995, supporting the HIV/AIDS community in Toronto, has partnered with the Toronto HIV/AIDS Network, THN, to develop a multi-agency HIV awareness core training program to educate and prepare volunteers from THN's partner agencies to support peer programs and other related supports within each individual member's organization. We engage communities by supporting the ongoing education initiatives of the Toronto HIV/AIDS Network, with administrative and practical resources, staff, training facilitators, and educators, providing a palliative care lens to support and service delivery within HIV-related topics, such as aging and comorbidities, and providing grief support, education, and hospice resources to the 40-plus partner agencies. We are most proud of being able to stay relevant within the HIV/AIDS communities. Over the years, our program has expanded to support many people, so it's important and special for us to stay connected to this community, and providing volunteers from over 40 agencies and health networks with education and resource on HIV and AIDS-related issues since 2016. We are located in Toronto. Our goal is to honor our organization's roots and increase education and access to hospice services in various locations. Our audience is members of the various HIV/AIDS communities in Toronto and volunteers from THN's partner agencies. For more information, here is our contact information. The next Compassionate Communities initiative to be featured is Dying Healed, a project of LifeCanada. Dying Healed is a project of LifeCanada. The term Dying Healed is a concept that explains how a person can pass from this life healed, not physically, but mentally, emotionally, and spiritually. It is not possible to heal all the pains that accompany disease and terminal illness, but we can help those suffering to experience healing of a deeper kind. The purpose of the Dying Healed program is to give volunteers confidence that their presence at the bedside of a lonely or dying person is an invaluable service. This program is intended to be a preparatory training for those who would like to spend time with the elderly, ill, disabled, or dying. Dying Healed workshops are hosted by LifeCanada supporters and member groups in communities all across Canada. During COVID, they have also been hosted online. Those who attend our workshops can receive additional online training to become a Dying Healed facilitator. Trained facilitators in turn host Dying Healed workshops in their own communities or online. We also offer our trained facilitators online networking sessions where they can find support and encouragement and the opportunity to share about the benefits and challenges they face as volunteers or as trainers of volunteers. LifeCanada created a comprehensive media campaign to promote our Dying Healed program in communities across Canada. We use the slogan, "Make time for life," to encourage prospective volunteers to take time out of their busy lives to spend time with the lonely, isolated, and dying in their communities. Our campaign includes social media advertising, video vignettes, and other promotional material that we distribute via our supporters and member groups across Canada. Our goal is to ensure that all Canadians make time to offer compassionate care to those around them in their communities, that they make time for life. LifeCanada held our first Dying Healed workshop in spring of 2017. We have hosted over 55 workshops in 35 communities across Canada and online. And we have trained over 1,300 volunteers to serve at Canada's hospitals, seniors' homes, hospices, and other care facilities. Dying Healed is all about providing hands-on, compassionate outreach in Canadian communities. Learn more about the Dying Healed program by visiting maketimeforlife.ca or calling 1-866-780-5433. The next Compassionate Communities initiative to be featured is the Healthy End of Life Project, HELP, Ottawa. HELP is a community-based research project. It is based on the model established at La Trobe University in Australia. It takes place at 4 sites around the city, 2 community health centers, and 2 faith groups. The project's initiatives are led by HELP facilitators, advisory councils, and site leads. Research is conducted by the research leads, facilitators, and university students. HELP Ottawa is midway through its 3.5-year project mandate. Funding and support are provided by partners in this research: Compassionate Ottawa and the Mock Geinsland Foundation of Canada. Our host institution is Carleton University's School of Social Work. The project aims are to implement an evidence-based participatory community development framework to increase community capacity around illness, dying, caregiving, and grieving, and to develop a collaborative end-of-life culture by normalizing conversations about caregiving and the end-of-life issues, building the knowledge and skills of family and community caregivers, mobilizing helping networks to support people who are frail, chronically or terminally ill, dying, grieving, or caregiving, and creating stronger partnerships between professional health and social care services and community members to support community palliative care. The initial research findings are based on interviews, focus groups, and consultations with 169 study participants. This baseline data collection was conducted in French, English, and Spanish. And yes, this was accomplished during the lockdowns and limitations of the pandemic. 3 overarching needs were identified across participant groups and sites. They were: people face challenges navigating the healthcare system and social services, and formal and informal community supports. People need to feel seen, heard, and respected across all settings. Caregivers especially need more recognition and support. Most people find it difficult to ask for help when they need it. The research findings were shared with the 4 community sites. Facilitators, advisory councils, and site leads responded by developing initiatives to begin to meet the needs. 14 initiatives were launched and completed to date, and there are more planned. Here are just a few. To support people in navigating the health and social service systems, as well as the community supports, the 4 sites each researched what services were available to their community members. Resource lists are now developed and will be linked to an asset map available on the Help Ottawa website. To support and recognize caregivers, one of the sites is organizing Messy Mondays, a Zoom meeting for caregivers to share their ups and downs with peers in an informal gathering. Another site has provided a more structured caregiver support group series, which involved presentations and discussions on important issues like self-care. And finally, to assist in asking and receiving help, we are reviewing the research data and exploring the themes, gaps, and successes to learn more. It is our current work in progress. Help is engaged in evaluations to learn where we are to go next. In addition to surveys, focus groups, and critical reflections, we chart the course for the project with the following ideas in mind. We will build on strengths such as facilitating the advanced care planning workshops and grief and bereavement workshops offered by help partner Compassionate Ottawa. These may grow in number and may be offered in collaboration with neighboring communities and faith groups. We will explore the challenge of asking for help. How do we build a culture and capacity for asking and receiving help? We will assemble the stories of help through an arts-based research approach to data collection. A series of workshops on developing a story is being planned by a local arts group, the Ottawa Storytellers. During the workshops, participants from each of the 4 sites will write their stories about experience with a Help Ottawa initiative. We look forward to hearing their stories and sharing them with you. For more information, see our website. The next Compassionate Communities initiative to be featured is Dying with Dignity Canada, the Greater Toronto Area chapter. With the National Office of Dying with Dignity Canada located in Toronto, staff from DWDC served as the de facto GTA chapter. When a few DWDC volunteers noted that the megacity needed its own representation, they stepped up, unprompted, to create a standalone chapter. The executive and core team met for the first time in January of 2021 and haven't looked back since. Echoing the mission of the Dying with Dignity Canada, the Greater Toronto Area chapter's mission is to work to make residents in the Greater Toronto Area aware of their rights to access quality end-of-life choice and care. Their vision is that everyone has a right to choose a good death, and their core values also reflect those of the national organization. That the work the chapter undertakes be centered on what the people in their communities need, and that it be carried out with compassion, integrity, courage, and in collaboration with others. The chapter set out 3 simple goals for its first year: build, educate, and support. First and foremost, they wanted to establish a chapter that ably supports DWDC to achieve its goal to become a leader for assisted dying and end-of-life choice in Canada. Over the course of 2021, despite the pandemic, they reached out to people, they helped people through presentations on medical assistance in dying and advanced care planning. Audiences have been a mix of seniors groups of mixed ethnicities, religious groups, and general audiences. As of October 2021, the chapter has made inroads towards achieving its short-term goals. A 5-person executive runs the chapter, and a core team of 12 delivers the chapter's services. Training workshops have been held and presenters have been engaged to make presentations on medical assistance in dying and advanced care planning. So far, nearly 30 presentations and workshops have been held, reaching a total of more than 600 people. Nearly 2,000 volunteer hours have been tracked. It takes a lot of person hours to build a chapter from scratch. Routine communications go out monthly to chapter supporters, and through various outreach efforts, nearly 3,000 people have been contacted. With its first year nearly over, in 2022, the GTA chapter of Dying with Dignity Canada will boost its activities in support of the National Office, with a focus on advocating for improvements to MAiD legislation. Building on the success of its inaugural year, the chapter plans to begin delivering presentations and workshops in person in 2022, and to broaden its outreach efforts. The members are proud to have coalesced as a group, despite the fact that many of them have never met in real life. The collaboration and cooperation achieved is one of their biggest accomplishments. The chapter has great expectations for the contributions it will make as a member of the GTA's Compassionate Communities. The next Compassionate Communities initiative to be featured is Compassionate Ottawa. Compassionate Ottawa, CO, was established in late 2016 as an independent community-based organization. We serve the population of Ottawa, Canada, with a population of 1 million in both English and French. Our activities are overseen by a 12-person board of directors carried out by our 80-plus volunteers with the assistance of our 2-person staff. Our vision is the vision for the City of Ottawa and not Compassionate Ottawa. We started out by focusing on conversations and advanced care planning workshops. A partner organization helped train our facilitators. We slowly added new initiatives based on community input, working with community partners. We have received strong support from the community, including important financial support. This diagram describes our current activities. The center of the circle indicates that we provide a community model of caring, which is based on community development and public health principles. The inner ring shows the various ways in which we connect with our community. Teams lead the work in a number of these initiatives, such as ACP, grief and bereavement, and caregiver support, and they work with our teams, leading our work with schools, workplaces, and faith communities. Our work involves sponsoring 2 funded projects designed to provide practical tools that can be used in community engagement activities. The outer ring describes our capacity-building activities, such as partnerships, evaluation, marketing and communications, and volunteer engagement. These activities are led by teams. We recently completed a strategic plan which identifies a number of priorities we will be working on over the next 3 to 4 years. These priorities include reaching out to those who experience discrimination or who are marginalized, providing knowledge and tools for our workshops, researching public knowledge about death and grief to inform our work, hosting a citywide event in collaboration with others to mark the passing of the pandemic and the impact it has had on our community, enhancing our bilingual activities, and ensuring that our organization is strong and stable. We are encouraged by the support for a community model of caring that works in collaboration with health providers and social agencies. We invite you to visit our websites, English and French, and contact us for more information. Our initiative is currently supporting conversations about advanced care planning. The purpose is to get community members to have conversations with their family about their advanced care plan and/or help them create their plan with free resources. We also support 2 peer support groups, one focused on caregivers and the other on grief. These sessions create a safe place for people to connect about their experience, share knowledge and resources, and foster connection. All of these programs are hosted at the local community center, followed by lunch. We are proud that our initiative and programs are supported by volunteers. The amount of time our volunteers dedicate is inspiring. The next Compassionate Communities initiative to be featured is MAiDHouse. MAiDHouse is a nonprofit organization devoted to providing a supportive, inclusive, and home-like setting for medical assistance in dying, MAiD. We are a group of doctors, nurse practitioners, ethicists, advocates, and volunteers who believe in choice, tranquility, and dignity at the end of life for patients and their families. MAiDHouse is an innovative program and is the first of its kind in Canada. MAiDHouse is creating a home-like setting where those who are eligible and choose MAiD can have the end-of-life experience of their choosing. The MAiDHouse facility is the first of its kind in Canada, providing equal access to space for anyone eligible for MAiD. MAiDHouse services are provided free of charge, ensuring that cost is not a barrier to access. MAiDHouse is passionate and committed to improving the experiences and well-being and overall end-of-life experience of individuals who are dealing with a serious health challenge and those who are caregiving, dying, or grieving. Our inaugural location is in Toronto. We envision the expansion of the MAiDHouse model into communities throughout Canada, providing all Canadians with the opportunity to choose a safe, welcoming, and dignified place to fulfill their end-of-life decision. MAiDHouse will be working with local community organizations in the development of our grief and bereavement programs. Ensuring we are accessible and working with volunteers will be a key component of our programming. We are having continuing conversations with the community to understand the needs and get advice about the development of our programs to ensure our programs are grounded in community and meet the need. Currently, we provide virtual education sessions that cover a variety of topics, including grief and bereavement. MAiDHouse is the first of its kind in Canada to begin development of a dedicated community-based center for those eligible to receive medical assistance in dying, ensuring there are community-based services to meet our legislative rights. More than 87% of Canadians agree with this end-of-life choice, and over 21,500 people have chosen this option in the past 5 years. Current gaps in the system, however, do not allow equal access to this intervention because not everybody has a place to die peacefully or access to the necessary grief and bereavement support. End-of-life care is a critical factor in dying well and has a direct impact on the health and well-being of individuals at end of life and those supporting them. MAiDHouse is committed to collaborating across sectors towards creating and supporting an equitable end-of-life care system in which a community-based organization focused on access to MAiD and the surrounding supports is one of the many pieces of that end-of-life system. An environment is created where the important conversation and education around end-of-life is facilitated and supported. For many people seeking MAiD, home is not an option. Reasons may include concern about a loved one's association of their home with death and loss. Many faith-based health facilities do not allow MAiD. The marginally housed do not have a suitable space. Family members may not be supportive of MAiD. Gregory was the first person to receive MAiD at MAiDHouse's temporary location. For more information, email us or visit our website. The next Compassionate Communities initiative to be featured is St. Albert Sturgeon Hospice Association, SASHA. The St. Albert and Sturgeon Hospice Association, SASHA, is a volunteer-run foundation. We came together in October 2013 as a grassroots organization and began an awareness campaign to seek support from the public, politicians, healthcare officials, and community service groups to bring hospice beds to our region. We became a registered society in 2014. SASHA received charitable status from the Canada Revenue Agency in 2015. High-level advocacy led Alberta Health Services to delegate and eventually manage Foyer-Lacombe Hospice to serve North Edmonton, St. Albert, Sturgeon, and areas within the Edmonton Health Zone. Once the Foyer-Lacombe Hospice opened in 2017, SASHA moved to the community offering programs to support, educate, and empower those affected by or caring for a person with a life-limiting illness. At the same time, there has been ongoing work to support outfitting Foyer Lacombe Hospice with equipment to enhance the quality of life of those admitted to the site. Trained volunteers are matched with end-of-life clients and their caregivers in their homes to help support those who do not make it to hospice care due to waiting times or wish to stay at home, but still require a helping hand with respite, companionship, or simply help with errands. Hospice teas are hosted twice a month. Volunteers bring out the fine china and serve residents and visitors a pastry and beverage and spend some time talking and sharing stories. This is a practical way to demonstrate our vision of honoring people in their end-of-life care by bringing some joy to the normal routines of hospice. During the pandemic, SASHA was not able to meet with clients. The Compassion Bag project was implemented in December 2020. Bags were given to residents of the hospice and end-of-life clients in the community through home care. Our Compassion Bags, assembled by our volunteers, show caring and support from the community for both the person who is ill and their caregiver. Connect Cafe is a reflection of our vision. We are committed to providing opportunities for members of the community to gather for presentations on a variety of topics, such as advanced care planning, available palliative supports in the community, and how to discuss medical wishes with loved ones. SASHA has begun an annual fundraiser called Lighting the Way, which is an awareness, empowerment, and support activity that honors those who are dying, those who have died, and those who are grieving. SASHA will be hosting Unpacking for the Journey in May 2022, a fundraising awareness event featuring Mr. David McGinley, renowned Canadian author. Participants will learn how practical and spiritual preparation not only helps one face mortality, but also helps heal the heart and connect with hope. As friends of Foyer Lacombe Hospice, we continue to support initiatives to enhance the experience of the hospice residents and promote awareness and advocacy in palliative care. Through fundraising efforts, we have participated in updating the tub room and providing sleeping or recliner chairs for each of the 10 rooms at Foyer Lacombe for residents and their families. For more information about SASHA, please look at our website, Facebook, or Instagram. Thank you for joining us on the first World Compassionate Communities Day. We hope you enjoyed learning about our Compassionate Communities initiatives in Canada, and please reach out to any of the examples featured. Have a great day.